Hi there. Welcome to Core Chiropractic. My name is Dr. Joanne Giesenhaus, or everyone calls me Dr. Joe. Welcome. This is to let you know what we're going to be doing when you actually come to Core Chiropractic. When you enter, you're actually going to sign in here. One of the team members that'll be here will be actually greeting you. They're going to give you some additional paperwork if you actually still need to fill that out, and then you'll come right here in this reception area and actually do that. After that's complete, you're going to come on with me, and we're going to go all the way back here to the exam room, okay? When we're actually in the exam room, this is really where that detective work starts, right? We want to get to the root cause of what's going on with your body and why your body is actually signaling what it's signaling. You know, it might be signaling things up here for neck pain, headaches, TMJ, shoulder pain, maybe mid-back pain. How about low back pain, right? We're talking sciaticas. We're talking that pain that can actually radiate in the front, maybe down into the hips, knees, feet. So we really want to take a deep dive when we do that. And how we actually accomplish that is I do a one-on-one with you, or actually one of my team members as well. And then we get those specific details of what's causing it and that root cause itself. We then do a biostructural examination, and what that is we have you actually do a step up on bilateral scales. And what that bilateral scale is going to do, it's going to show me whether that body is shifted to the right, shifted to the left, because we want to actually map what's going on the outside of the body to the inside of the body. We are also going to do a postural digital screening. What that's also going to do is show me any distortions on the outside of the body. Posture's huge. It is the mirror of actually what's going on in the spine itself. It's going to show me, hey, do I have a high right shoulder? Oh my gosh, how about this posture, right? With the phones, the head at our desk, right? It's going to show me what's happening on the outside of the body. Then once we have that, we're also going to do a spinal examination, which I'll be performing. And what we'll be doing here, you'll be laying face down or seated, and I'll be palpating along that spine to look for any stuck joints, any muscle asymmetry along that, like tightness, soreness, stiffness. Once we complete that, then we're going to take digital x-rays in motion. Super cool stuff right here. This really separates us out, okay? What we do with the motion study x-rays is actually put that spine in motion, right? We're going to have you bend forward and bend back. We're going to twist and twist. And once we get those pictures of the inside, we're looking for any of the bones right here along the spine to be stuck. If we're able to locate those stuck bones, we can help. Now, those stuck bones, when we do find them, they could be giving us a condition, a very dangerous condition called a vertebral subluxation. If you have a vertebral subluxation and we find it, we can correct it. What a vertebral subluxation is when that bone gets jarred out of place or stuck out of place. It can put pressure on those nerves that are coming off into the body. Those nerves innervate every single thing in your body, every muscle, ligament, tendon in the body. And if there isn't proper communication going from the brain, down the spinal cord, into those spinal nerves, we can get those things like we talked about, those body signals. Maybe that's sciatica, neck pain, back pain, headaches, things of that nature. So we map that with those motion study x-rays. And those motion studies x-rays are super important because we not only take them now, but we then take them later on in care to show you your progress. After we do that, we put all that information. You either come back that next day or that same day, or the following day, where we sit one-on-one with you and explain those motion study x-rays along with all our other findings and put you on what we call a corrective care plan. Then, once we do that, we're gonna go right into the adjusting room, okay? And the adjusting room is actually where we perform the adjustment. So we'll come right in here and we do that adjustment either seated or the traditional way of laying down. Some patients actually can't lie down, so we actually can do that seated as well. This is where we use actually one of many techniques, but it is also called the arthro stim. And you'll hear a tap, 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 tap. What the ArthroStim is actually doing is we're going along that spine and actually removing those subluxations or those vertebral subluxations. We're actually aligning the spine and allowing the nervous system to restore and recover. We also use another instrument, very powerful instrument, very gentle as well, loved by all the patients. It's called a vibrocusser. Super important. The vibrocusser increases blood and oxygen to those surrounding tissues and also into the disc space, so that body can actually restore itself as well, get that cushion back and take pressure off the nerve, okay? Once we perform those adjustments, then we go right into the therapy suite, because we want you to actually hold that correction that we just made, okay? So we're going to come all the way down in here. This is one of many therapy suites. So one of the things we do to correct and stabilize the spine, because that's so important. So not only are we removing those subluxations, but now we have to correct and stabilize them so they hold it. So you never have to go back there again, okay? So I'm just going to show you some of the things that we use, but we use many. So one would be a spinal traction, okay, where that actually, and that's all one-on-one, and where that actually is opening up those disc spaces so nourishment gets in there and that disc stays nice and cushioned. Some of the other things we do here are for also disc, and this is actually to pump the disc and actually train that core, that big structure of those 250 muscles, ligaments, and tendons in the core to actually hold that proper adjustment, okay? All done one-on-one. We also have some resistant bands too that we use for shoulders, for mid-back, low back, neck as well, all to demonstrate, stabilize, and correct those subluxations that we just adjusted. You know, we do this so we want you to live the life you want to live and do what you want to do. Thank you.